In this brief presentation, I will review the basics of how to write an institutional policy. Many fine references exist on the subject, so this presentation will simply summarize the most salient points. The purpose of this presentation is to give you the basics of how to write an institutional policy. It will provide a description of both what a policy is and what it is not. In addition, it will list some of the circumstances when a policy is required by regulatory or certifying bodies versus when a policy is optional but still a good idea. It will describe the basics of what a policy should contain in order to be usable and how to use the best current evidence to support the individual tenets of a given policy. It will also address what institutional personnel should be involved in the writing of a policy in order for a policy to meet the broadest needs of an institution. This presentation will not cover how to write a procedure, which is a separate item. However, many of the skills needed for writing a policy are equally applicable to the writing of a procedure. No presentation can address all possible situations. However, the goal is to give you enough background that you can be successful with your first experience. Before you can write a policy, you really need to understand what a policy is and what it's intended to do. In its most basic form, a policy is a statement of governing principles that reflects the philosophies, beliefs, and/or goals of an institution. Do not confuse policies and procedures. A policy is different from a procedure. A policy is a statement of a global goal. A procedure is a series of steps undertaken to implement a policy. A policy states why. A procedure states how. For example, an institution might have a policy that states that all patients will be identified by 2 methods prior to administration of medications in order to avoid errors. The procedure that corresponds to this policy would delineate the exact steps a provider would go through to properly identify the patient. Policies generally change less frequently than procedures, since policies are general and procedures are specific. So as technology evolves and equipment changes, procedures need to change with them. Again, using the example on patient identification, the policy could remain the same, 2 methods of identification, but the procedure might change several times as it follows technological advancements in healthcare, from using armbands to barcode reading to biometric scanning. There are circumstances when a policy is an option an institution elects to use, and there are circumstances when specific policies might be required by accrediting, certifying, licensing, or regulatory bodies such as the Joint Commission. For example, institutions are almost universally required to have policies in place for situations such as how to deal with provider exposure to bloodborne pathogens, hospital emergencies like fires, and unanticipated events such as medication errors. On the other hand, a hospital may elect to have some policies to facilitate the operation of the institution and give guidance to employees, such as a policy on family presence during CPR or a policy on hurricanes or winter blizzard events. Be clear on whether the policy you are writing is optional or is required by one or more regulatory bodies. Mandatory policies required by regulatory organizations often have very specific content that must be included, and you need to be clear on the precise requirements before you begin. Most institutions have someone in charge of each specific accreditation process who can offer you guidance on what to include. If more than one accreditation or certification impacts the policy, you need to be sure the policy meets all the relevant regulations, not just one. The exact process of policy writing or updated is commonly determined by institutional procedures. But in general, policies are reviewed every set number of years, often every 3 years, and revisions are made as needed. New policies are written as practices change or when precipitated by events that seem to indicate that institutional level guidance is required. Policies may be written or revised by any number of people, but there is generally a formal approval process that may involve one or more committees, as well as high-ranking institutional administrators. A simple policy applicable to only one department may have a quick review by a single committee, whereas a complex policy impacting departments across the organization may need to be reviewed and approved by several committees. Policies will eventually need to be signed by the administrator under whose purview they fall. generally someone like the Chief Nursing Officer, the Chief Medical Officer, or the Chief Executive Officer. It's important to understand all who will be approving the policy before beginning to write it. So before you begin to write a policy, you should meet with any stakeholders who will be affected by the policy or who have a specific interest in it. Depending upon the type of policy you are writing, this may include administrators, the chairpersons of involved approval committees, human resources professionals, legal experts, and regulatory experts, as well as clinical services leaders. Policies rarely affect only one clinical area, so be sure to contact all the clinical entities that will be impacted. For example, a policy on ICU admission of ventilator-dependent patients could affect the ICUs, the pharmacy, the operating room, the emergency department, central records, and respiratory services, just to name a few. Consulting with stakeholders before you begin writing the policy gives you a broad view on what needs to be included and what is important to all those concerned. It also gives you buy-in from the affected departments or individuals so that when the policy comes up for final review, they will already have had their input and be ready to support it. Avoid the temptation to use a policy as a political method to force your point of view on others or help your department get its way. A policy should never be written as a political instrument to try to force one group's opinion on everyone by making it an institutional decree. Even if such a politically motivated policy were to be approved, which is unlikely, it would never be embraced by the broader institution and so would prove to be unenforceable. I cannot emphasize enough that collaboration and consensus are critical when creating institutional policies in order to create a policy that works for the entire institution, not just for one or two groups. After talking to the stakeholders, but before beginning the policy, you should gather the most current evidence available on the topic. Generally, this means evidence that is less than 10 years old, and more ideally less than 5 years old. The evidence should be academic and should be from reputable scholarly sources. Avoid the temptation to just grab a textbook and use it as the basis for the policy. You should consult texts, journals, and government publications, as well as web resources of professional organizations to gain a broad and complete understanding of the topic. Remember, just because it's a healthcare policy does not mean that there is not something applicable in the non-healthcare literature. Likewise, even if it's a nursing policy, other healthcare literature may have good information to offer as well. Your examination of the evidence should be comprehensive before you sit down to actually start writing. Understanding the state of the science will make the writing go much more quickly. In addition, having good evidence will allow you to explain and defend your policy choices when the policy is under review. You will likely have little to no choice in how the policy you are writing is structured, as nearly every institution will have a required format for all of their policies. The purpose of an institutional format is to ensure that all policies cover the basic requirements that the institutional administration believes are important. It also makes it easier for those who have to read the policies to find key elements, as the format and presentation is consistent and therefore easier to follow. Do not deviate from the format required by your institution. This will only mean that you will have to eventually rewrite the policy to adhere to the required format. The best approach is to read a number of recently revised policies in the institutional format in order to get a feel for how they flow and how much detail is needed. Be sure the policies are recently approved, as they will then reflect the present institutional practices. Older policies may not represent the current requirements of the institution and will cause you to have to perform time-consuming rewrites. Some institutions have quite detailed policies, while others prefer a more brief, global approach. Try to review policies similar to the one you are about to write, as often a clinical policy, a human resources policy, an administrative policy will all be presented quite differently. Also, just because you are only revising or updating a policy, don't assume that the format will remain the same. Formats are often updated to meet new requirements, and you may find that the quick update you were assigned will require a complete rewrite in order to meet the new formatting guidelines. For this presentation, I will cover the most basic components that appear in most policies: the purpose, the scope, the definitions, the policy itself, and the references and evidence. The purpose statement is the rationale for the existence of the policy. It should be brief, no more than a paragraph. It should be specific and exact, and it should clearly state the purpose of the policy and what it is designed to do. If the policy is needed because of regulatory requirements, these external regulations should be referenced here. Institutional memory is short, and the impetus for certain actions can be quickly forgotten. The purpose statement should serve to remind everyone why the policy was created to begin with. Someone who reads the purpose statement should have no question about why the policy exists. The scope of the policy should clearly list the persons, departments, and organizations to whom the policy applies. If needed, you can specifically list exceptions if there are those within the group to whom it does not apply. But in general, try to make the list of who is covered exact enough that a list of who is not covered won't be needed. For example, if a patient care-related policy, if the scope is all RNs, an exhaustive list of exceptions would need to be made for nurses working outside of patient care. However, if the scope of the policy is narrowed to RNs working in direct patient care role, then a long list of exceptions would not be needed. Remember that in certain situations, scope may also need to be extended to other settings, such as transport vehicles, or other departments such as dietary services. Be careful in defining the scope, though, that you do not try to encompass things over which the institution has no direct control. For example, a hospital policy on trauma care could not be used to constrain the actions of pre-hospital providers who were employees of another organization which was not under the control of the hospital. Definitions are provided as part of a policy in order to make explicit how certain words are being interpreted in the policy. Using exact terms is critical to the policy being understandable. Be sure to use the same terms to convey the same information throughout the document to avoid confusion. For example, if a nursing unit is being discussed, use the same term throughout. Do not refer to it as a nursing unit in one place, a floor in another, a ward in another, and a department in yet another. Terms must be clear, unambiguous, explicit. You need not define every term, only the ones critical to your policy and that are subject to multiple interpretations. For example, if you were doing a policy on family presence during resuscitation, you would need to define explicitly what constituted a resuscitation event, whereas the term RN would probably need no definition at all for most policies. A definition may be brief, only a few words, or if it is a complex concept, it might be a short paragraph in length. The policy itself is where the reader is given direction on what to do and what not to do. A single policy is generally made up of multiple decrees that are called policy statements. Policy statements should be high-level statements that address general principles. The statements should be very specific and carefully worded as they carry the weight of institutional law for the employees. For example, using the word must indicates that an action is mandatory and the employee is required to adhere to it. The words recommended or may, on the other hand, indicate that the employee has a choice to either adhere to the statement or not. Do not use more stilted terms such as should, shall, or will, as their meaning is less clear to non-lawyers and may lead to misinterpretation. Policies should be general enough that they are not quickly outdated. Never include the names of individuals, but use position titles instead. For example, use the Chief Nursing Officer, not Chris Smith. To avoid confusion when using titles, be sure that the title as used in the policy matches exactly the title as defined by the institution and listed in the Human Resources documents. Additionally, don't use brand names of products, but use generic terms. For example, chest tube drainage device, not Plurivac, or acuity assessment system, not Apache. Do not forget to include allowable exceptions if there are any. Most points in a policy should contain citations to appropriate evidence supporting that policy item. Again, all points within the policy that refer to specific content must have citations to appropriate evidence supporting the policy items. These must match a reference list at the end of the policy. Be sure to format the reference list in the correct bibliographic format as used by your institution. When authoring a policy, you should always provide citations and a reference list, even if they will not be published as part of the final policy. This allows those who review policies to see the evidence upon which you based your policy statements. Information about related institutional policies, procedures, forms, etc. should be listed here as well. To summarize, here are the basic steps in writing a policy. First and foremost, be clear on the requirements for the policy, including the format, the desired content, and any relevant regulatory requirements. Next, meet with individuals who should be involved, consulted about the writing of a policy to get their input. Following that, search for the most current, relevant evidence to guide the policy content. Then and only then can you actually draft the policy. Once you have what you believe is a complete draft, send it back to the relevant individuals to get their input on the draft. Once you have this input, you can finalize the policy for submission to whatever review system your institution employs. This has been a brief review of the basics of writing a hospital or institutional policy. I hope this review has helped you to better understand the steps of the process and the elements that should be considered before and during the writing process. Please contact your faculty member if you need more assistance. Good luck and enjoy writing your first policy.